Good morning and welcome. We're going to convene as the Shawnee County Board of Health. And I would like to welcome you all to the April 21st, 2014 meeting. This is a new way to do business for Shawnee County, and I think it's a big deal. And I want to welcome everyone. My name is Bob Archer. I'm the chair for the Board of County Commissioners, and I represent District 3. To my right is Commissioner Kevin Cook, who represents District 2, and to my left is Commissioner Shelley Bueller, who represents District 1. Together, the three of us serve as the Board of Health for Shawnee County. The purpose of our meeting is in this Board of Health meeting and additional meetings is to discuss, number one, the 2014 Shawnee County Health Rankings, critical metrics that we need to discuss. And then secondly, the Community Health Improvement Planning process. We have a full agenda today, but before we get started, I'd like to acknowledge and recognize some of the special guests that we have in attendance. And as I call your group, if you'd stand up, and I would appreciate it. Number one, members of the Healthy Shawnee County Task Force.
We have representatives from the hospital here as well.
Okay. Second group is members of the Heartland Healthy Neighborhoods Leadership Team. Is that? Thank you. And then finally, management team for the Shawnee County Health Agency. Okay. Welcome all. We will also have several presenters today, including the local health department director, the health officer for Shawnee County, and committee chairs from the Heartland Healthy Neighborhoods work groups. Thank you all for taking time out of your schedule to attend this very important meeting. And the good news is that the meeting is being streamed live on the Shawnee County website. It's also being recorded, and it will be available on the website in the future for the public to view. Also, there will be an opportunity to do public comment and a question and answer session. So I will now let Allison Lejos, Director of the local health department, begin. And again, thank you for organizing this opportunity. And like I say, this is a big deal. Thank you.
It's a big deal. Thank you for letting us have this meeting. I just want to acknowledge the commissioners and your support for this work that we're doing. The Board of County Commissioners are a very important function in our community, but what may not be known to others is that the County Commission also serves as the Board of Health. This is the statute, just a summary of the statute. We actually see across the state that county commissioners are actually the designated Board of Health within each community. One of the things that I also included here was to say that we also appoint a physician to serve in an advisory capacity to the board and serve as the local health officer. And we are very fortunate to have Dr. John Franco Pizzino as the Shawnee County Health Officer. He has been in this capacity for, I believe, since 2007, so a very long time he's been with us. I've worked with Dr. Pizzino at the state health department as well, and he brings with him a wealth of knowledge that we get to benefit from here in Shawnee County. The goals of some of our Board of Health meetings are going to be to really increase the knowledge and awareness of you all as the commissioners and the Board of Health, along with the community as a whole. We want to be able to provide updates to you as it relates to public health matters, to public health programs and different interventions that we're doing within our community to keep folks healthy. We also want to be able to move towards meeting our accreditation requirements. That is something that is a fairly new accreditation. There's an accreditation board for public health entities, and we are very interested in achieving accreditation in the future. So the meetings that we're having now will help us meet those requirements. ultimately, what we are hoping to achieve through these meetings is being able to provide you as the Board of Health with the information that you need to make informed decisions and set health policies in the most informed manner. So with that, I'm going to go ahead and let Dr. Pizzino come up and talk about the county health rankings.
Good morning, everyone. I'm very pleased to be here, and I want, first of all, to congratulate you for your vision. You are one of a handful boards of county commissioners in the state that has decided to date to convene as a Board of Health. And this is truly considered these days as the best practice to have a good, solid governance system for public health in your community. So I truly appreciate you taking some extra time to do this business with us today. What I would like to do is to spend just a few minutes talking about the health in Shawnee County, and I want to do that using the information provided by a national project called County Health Rankings. That's a project that's been running for, I believe, 5 years now, and essentially compares the health in each community within our state, in each county within our state, with that of the counties in the rest of the state. And I think the reason we do that is probably pretty simple. When we don't put numbers in a context, it's very hard to understand what they mean. If I tell you that the teen pregnancy rate in our county is 50 per 1,000 women aged 15 to 19, probably your first reaction is, what does it mean? And what do the people in next county do? What do the people in Wichita do? Mm-hmm. It's only when you put those numbers in a context that you do understand what they mean, and if we can improve on that, or if we are already doing pretty well, we can be satisfied with that. So with that in mind, I know this looks a little busy, but I promise I will spend only 20 seconds on this. But this is essentially the logic that's behind the project. When we think about health, most of us will immediately think about disease and death. Those are the two top things that will come to our mind. How young people die and how well they are when they are alive. But we know that there is a variety of factors that actually affect how young people are when they die and how healthy they are where they live. And that's what we refer to as the health factors. And I will talk about that in a moment. You know, we have health behaviors, clinical care, socioeconomic factors, and physical environment. Those are the drivers towards health. And by affecting those factors, we can affect ultimately death and disease. At the very bottom, you see, last but not least, it's in red, policies and programs. That's probably where you fit in. You fit in actually in the whole picture, of course, but that's really, I think, for your primary consumption. Through policies and programs, you have the power to affect those factors that in turn will determine how healthy our community is. How do we find that information? It's not easy, but essentially there were some criteria that the people at the University of Wisconsin that run this project decided to use. First of all, we are really interested in measures that are action-oriented. We are not interested in measuring things for which there is really nothing anybody can do, essentially. We are also interested in having measures available at the local level, and that's a problem in a state like Kansas with rural communities that sometimes are so small that just you don't have a big enough count of events to make sense of it. And we want to use things that are either free or low cost and they are up to date as possible. We have no interest in promoting a very high number of measures. We have about 30, 35, I think, is the current report, and I doubt that it will be much higher than that in the future. There is a lot of data out there. Now, not all the data will fit the requirements that I showed you a moment ago. But one thing I want to stress is that for this project, there is really no original data collection. This is all data that's available in the public domain. Some of this comes from the Bureau of Census, some of this comes from our state health department. The project really, what it does, it assembles the data and puts the data in perspective. Okay, so a little bit in more detail, how do we measure health? These are the two main outcomes. That's the traditional concept of health. Length of life, it's in a measure of how long we live. In technical terms, that would be the years of potential life loss, which means We measure how many years an individual who dies in our community would have been expected to live on average if he hadn't died. And the cutoff point that we use is 75 years. So we assume that everyone, in theory, should die at 75. If someone dies at age 50, that would be 25 years of life lost. Of course, that's an average. It doesn't mean that everyone is really expected to die at age 75. I hope that some of us will actually live longer. But it's just an easy way to measure on aggregate how young people are in our community when they die. The second is a measure of quality of life. It measures how well we live. And that's done by asking people, actually, through national surveys, things like how many days last month you would say you were in a poor health. How many days did you have, how many times you had to see a doctor in the last few months. And in doing that, then people construct indexes, and that's how we measure how the quality of life while people are alive. But as I said, that's only part of the story. Behind those health outcomes, there are these powerful factors that will drive them. And we have 4 groups here. One of them, of course, is clinical care. We all know that, right? When we are sick, we want to have a good doctor and a good hospital to go to that can take care of us. The fact is, the research shows that clinical care is only responsible for about 20% of our health. 20%. I mean, most people are shocked when we tell them that. The remaining 80% has really very little to do with the healthcare system. And the bulk of those factors actually fall in the socio-economic factors, things like poverty, education, housing, that also goes to the physical environment, crime rate. There is research published that clearly shows how all those and many other things in that group will affect the health of a community. And then we have health behaviors. Of course, we all know that, if we smoke, that's not good for our health. What we eat, how much we exercise will determine how healthy we are. And that accounts for about 30%. And finally, there is a physical environment. And you know very well these things because you have made very important decisions to improve the physical environment in our community by encouraging people to be more active, to use our parks better, to use bicycles in town, and so on. So these are the 4 groups, and within each group we have several measures through which we measure how healthy our community is likely to be in the future if these factors remain constant or if they change one direction or the other. I know we are interested in Shawnee County, and I will get to those numbers in a moment, but I want to give you an idea of what the result of all that activity is. This is a map of Kansas, of course. Darker is worse, and lighter is better. And this is how each county in Kansas would rank in terms of health factors. So these are the 4 categories I showed you earlier. There are a few counties that were not ranked this year because they just don't have enough data. So overall, there were 98 counties that were ranked, and these are the health outcomes. And I want to show those 2 maps next to each other for you. And there is a couple of things that strike me. One is this big spot in the lower right corner in the state, both for health outcomes and health factors. That's Southeast Kansas. And I'm sure that you're at least as familiar, probably more familiar than I am with the part of the state and the level of poverty and social challenges that those communities face. Well, look how that affects health. The other thing that strikes me is that there is a lot of disparities even for neighboring counties sometimes. You don't have to go very far and just look at Wyandotte and Johnson County. They are literally number 1 and number 98 this year. Neighboring community, same access to facilities in terms of health care. KU Med Centers in Wyandotte County is a nationally renowned medical facility, and yet their community is at the bottom. And I think that's the power of this kind of exercise, to show how this information can all get together and how when we start comparing and look at the patterns, this all makes more sense. But enough with that, let's look more at Shawnee County. Yes. Yes. And the numbers I'm going to show you now are a subset of the numbers that you have in the sheet here in front of you. So I want to start from the socioeconomic factors here. We will get to the health outcomes, so death and disease at the end. And the reason I hope by now is clear. That's only the final chain of the link in that chain of events. We have here you have a column with the values in Shawnee County, and you have a column with the average in Kansas. And you can see when it comes to socioeconomic factors, our county ranks 86 out of 98 that were ranked in the state. So it's not 86 out of 105, 86 out of 98. Some of the things that affect the ranking are violent crime rate, children in single parent house, 39% in our county as opposed to 29% in the rest of the state. About 1 out of 4 children live in poverty in our county. In the high school graduation is at 77 as opposed to 83 in the rest of the state. So essentially we have, compared to the rest of the state, less educated, more poor community. Probably I'm not shocking anyone when I say that. I assume you know that already. Now I added at the bottom the health factors, and these are actually the health behaviors. And you can see that we rank 62 out of 98. We have about the same rate of physical inactivity in the rest of the state, which is pretty bad already for the state of Kansas. But look at sexually transmitted diseases, how high they are, and look at the teen birth rate. Remember I told you 50 out of 1,000? That was the real number. It probably didn't mean very much to you, but when I tell you that the average in the state is 41, you probably start to realize that we have a problem. Now the good news is the clinical care. We rank 5 in the state. We have very good clinical care. We have 2 top-notch hospitals next to each other. They do an excellent job. Each of them is nationally recognized for certain things. So when we need doctors, assuming that we can access them, we do very well. But that alone is not enough to make us a healthy community. And I would still want to point out the fact that even in our county where we rank 5, we still have 30% of women for whom mammography is recommended. They do not get it. And we still have about 10% of people with diabetes that do not get screened as they should be. So even being number 5 is not, sometimes doesn't tell the whole story. Now here you see at the very bottom our health outcomes. So with that context, I don't think it's surprising when we see that we rank 66 out of 98. So we're not doing really that great. These are, again, just 2 examples. Our premature deaths are pretty much higher than in the rest of the state. So our members, the members in our community tend to die younger than in the rest of the state. Low birth weight, that's a percentage of babies that are born too small, and they often require very intensive care, and they can have lifetime consequences, and some of them will die prematurely, actually. We have 7.8% versus 7.2. Now, that 0.6% difference may not sound like a big deal, but actually it is, because those numbers really, a 0.1% difference can make a difference for, several babies and hundreds of thousands of dollars of costs and human suffering related to that. So those are our numbers for our county. Very quickly, a couple of limitations. I don't want to mislead people in thinking that this is a panacea that can explain everything about health. We already talked about a small county in some counties. Data timeliness is a little bit of an issue. You will hear in a few minutes a lot of good things that are happening in our county in terms of health interventions. You can't expect to see a result in a year or 2. For one thing, there is a lag in time when data become available. This report was just published. Most of the data were from 2010 to 2012. So there is a 3 to 5 years of gap before that data can become available. Second, these are just processes that take time. I like to look at this as a generational change. I hope I will be able to see some changes in our community before I'm gone, I'm no longer here. But I really hope that my kids will, and my grandkids. And that's really the type of frame that we need to operate under. There are a couple of things that these rankings cannot do. And one is, and I think that's important, it will not show you disparities within your own county. And I like to stress that, especially for counties that rank in the top, when I talk to people about Johnson County, I tell them, if you look, I'm sure you will find pockets in Johnson County where people don't fare that well, as the county aggregate numbers will show. And probably that's true also in our community. So how can we use this? It depends who you are. If you're a state policymaker, you may look at those two maps that I showed and see how the distribution of the rankings is. If you are here in the local policymaker or local government official, you probably want to know how you stack against your peers. But perhaps more interest from my point of view is what policies can we enact to improve the health factors? And that's a critical message in my mind that I would like for everyone to take home from today. When you as commissioners make decisions that affect the economy of our community, the built environment, how easy education is accessible for our kids, you are ultimately going to affect the health of our community. And that link may not always be very immediate to you, very visible, but it's there. This data just show you the link is always there. I think that's probably when I'm going to stop. I hope we will have a few minutes, maybe towards the end, to have a little bit of dialogue. I suspect you have a few questions in your mind, but I'm going to let Alison move on with our program.
Thank you, Dr. Pizzino. Now we're going to talk about the community health assessment, and this is repetitive for some of you, but I just want to put a reminder out there as to how we got to where we're at with the health improvement planning process. First off, in 2011, the hospitals and the health agencies started to meet to discuss the community health assessment. And we met because we had some requirements that we were trying to fulfill. The hospitals had some new regulatory requirements to meet IRS reporting that they had to work on. One of those was a community health assessment where they had to work with folks in the public health field. And the health agency needed to work on a community health assessment to, again, prepare for accreditation. So this was something that brought us together, but it wound up being a really good partnership. You can see here on the screen the folks that were actually from the Healthy Shawnee County Task Force. We do have, I would not be doing my job if I didn't acknowledge Mary Holman, who is no longer with St. Francis, but she was very instrumental in moving this community health assessment forward. And was a huge loss to our community. However, those partnerships are still very, very strong, and we are working very closely with now Paula Ellis from St. Francis, Tom Llewellyn from Stormont Vale, along with myself and Misty Kruger. And I'd also like to acknowledge, and I don't see him here, Bob Hedberg, who's no longer with the health agency. He also was very instrumental in moving this work forward. As we got together and really figured out what it was that we needed to do, we knew that we needed to have some input from other community leaders to help provide some direction and guidance on how we were going to move forward. So we established an assessment advisory committee, and you can see on the screen who was part of that work. This group was able to help us, one, identify the priority health needs in our community, and also really help provide that guidance and buy-in from the community as a whole. When we did our health assessment, we had lots of data that we were looking at. As Dr. Pizzino indicated earlier, we have lots of data at our fingertips. What we were able to use was the Kansas Health Matters website. There's lots of information out there that we were able to pull into a community perception survey. There were 48 indicators that we asked the community to respond to rate those different indicators based on how important they felt that they were. There were 777 individuals that actually took it. The information that was gathered from that survey was then analyzed by some students at the North Texas Health Science Center School of Public Health. They actually analyzed the data and put together a report based on those surveys. We also did focus groups here in our community, brought in healthcare professionals, social service professionals, and neighborhood leaders to really talk a little bit more in depth about what they felt was important. We also did some surveys and interviews of public health leaders in the community as well. The information that was gathered, you can see is summarized here. You can see there were 14 issues that were identified, and you can see who ranked those as being important on the slide here. And so what we were able to do was to put it in a more workable manner. So we grouped the different categories, grouped them into 3 categories rather. We've got those that are under the overweight and obese category, which includes eating fruits and vegetables, also talks about physical activity. We then have access to health services, and you can see there's a variety of things listed there. Just to make note, when we talk about access in this forum today, we're really only looking at access for the transportation and knowledge of services. The rest of those elements that are listed there are being actually looked at by the Safety Net Summit Group. So they are looking at that outside of our work at Heartland Healthy Neighborhood. And then also looking at infant mortality, and you can see the 3 categories of health issues that were put into that one. Okay, so now we have this information. We've got them grouped. Now what do we do? So we had a big task ahead of us. We've done the health assessment, and now the hard work is to begin. And so with that, I'm going to kind of turn this over to Tara, and I will just say that I actually approached Heartland Healthy Neighborhood, the leadership team, to see if we could use them as the vehicle for doing our community health improvement activity, and I'll let Tara kind of go a little bit more into that.
So, like Allison said, thank you, I'm Tara Dimmick, and my relationship right now is I'm the administrator for the Heartland Healthy Neighborhoods Coalition. And so at the time, Heartland Healthy Neighborhoods had finished up several projects, and they were getting into a new project with the Kansas Health Foundation with a grant that they had received to work on built environment. But they really were trying to focus on how they could best serve the community. And Allison came to us with the Community Health Improvement Plan, and it just seemed like the perfect fit for what the purpose of the coalition is. So as we move forward, as each one will get to kind of speak about these priority areas, we decided at that time to take Heartland Healthy Neighborhoods, which was somewhat more of it kind of come as a networking group to keep the coalition together. There was around 25 people that would come to a meeting on a regular basis. They would hear about policies or health behaviors, or just listen to other different groups that might be speaking about what's going on in their community or in their organization. And so this provided us a chance to completely change how we made Heartland Healthy Neighborhoods function. So it is now an organization where when they come to the monthly meetings, they are breaking into work groups immediately. They are working. Those meetings are not about socializing or networking, although that happens because we're together, but it brings over 50 organizations and individuals to these meetings to meet separately in these work groups. So the work groups were based on the needs of our community. So we have healthy babies, healthy eating and active living, access, transportation, and knowledge of healthcare services, and then Complete Streets, which Complete Streets was called Built Environment, and this isn't one of the areas of the Community Health Improvement Plan, but it made a lot of sense to connect it because this was what our grant was for with the Kansas Health Foundation. So each group, each one of these work groups separates into individual rooms, and they meet. They have worked to develop their strategies, their goals and objectives over the last 3 months, and just this month we celebrated all the work that had been done, and you can reference, do you have that sheet? This is the sheet that we will be discussing as each one comes up.
We're going to have Teresa Fisher from the Shawnee County Health Agency come up and talk about the Healthy Babies Work Group.
Thank you. Good morning. As Allison said, I'm Teresa Fisher, and I represent the Shawnee County Health Agency, and I co-chair the Healthy Babies Work Group. My other co-chair is Lisa Alexander, who represents St. Francis Health Center, who regrettably had a work commitment this morning. When we start looking at healthy babies, and specifically infant mortality, this indicator is often used to measure the health and well-being of a nation, and a lot of times in a community needs assessment, because a lot of times the factors that affect an entire population also impact our infant mortality rate. A little bit about infant mortality. The definition of that is the death of a baby before it reaches its first birthday. And we learned that babies in our county are dying at a large rate and greater than what others in our state are. The infant mortality rate is an estimate of the number of infant deaths for every 1,000 live births. So can kind of keep that in mind as we look at some of the statistics here. So our goal, our overall goal is to reduce infant mortality in Shawnee County to reach the Healthy People 2020 goal. It really has two different parts of it. Right now, our infant mortality rate is 8.3. And so our first goal is by 2017, we want to reach the state goal, which is 7. And then by 2020, we want to be to the Healthy People goal of 6. And so while those numbers, when you hear them, they appear to be relatively small. They represent a vast amount of work that we have to do in our community, and they also represent a large amount of babies that we want to see reaching their first birthday. Historically, we have had in Shawnee County one of the highest infant mortality rates, and so that's why we felt like this was a very important goal to work on. One thing that stands out when our work group came together, it became very evident from the first meeting that this was going to be where our work group chose to really work on. It became clear that it was very near and dear to the hearts of everyone who's represented in our work group. I would mention we have over 15 different agencies and organizations representing our work group right now, and we continually have more that come and join our work group. Our overall goal is that we want to work with our community partners and really create change in a systematic community-wide effort. Okay, so looking at our objectives, part of the problem of addressing infant mortality is really determining the root cause of infant mortality, and that's no easy task in and of itself. And so our work group, in doing brainstorming and coming together, ultimately chose these 3 objectives that they felt would hopefully impact our infant mortality rate. And so the first one is the reduction of infant deaths due to SUID, which is sudden unexplained infant death. And that includes SIDS, it includes sleep and rollover deaths, and anything that's an unknown death. And so for this particular data, we are going to be looking at kind of a 5-year time period. If we look at a single year, typically we get some data skewed for that. And so KDHE is working with us very hard to look at a 5-year data so that we don't have any peaks and valleys as we move forward with that. We feel that safe sleep practices are imperative for infants, and we know that there's lots of mixed messages right now about sleeping and what you should be doing with your infant. The breastfeeding, we're going to be looking at both increasing the breastfeeding rates and the duration. For the initiation piece, we're going to be looking at both of the hospitals, both Stormont Vale and St. Francis, and how many moms start out breastfeeding their infants there. And we'll also be looking at the WIC participants, how many of the WIC participants start breastfeeding their infants. And then for the duration piece, we're really looking at those moms that are on WIC still breastfeeding their babies, whether it's exclusive or partial, at 6 months. And so working on increasing that. And the sheet that's set before you has the exact numbers listed on them. There's many, many benefits to breastfeeding, but overall we know that those babies get more antibodies from their mom, and typically these babies are healthier than your formula-fed babies. And then when we look at early and adequate prenatal care as our last objective, early prenatal care, just to define that, is women who receive prenatal care beginning in their first trimester, which would be from the time of conception up until their 13th week. And so we'll be looking at increasing the number of women who are entering care during that time. For the adequate piece, that's defined as moms who enter prenatal care by their 4th month and then attend at least 80% of their recommended prenatal visits as recommended by their provider. So we'll be looking at a couple pieces of that. We definitely know that prenatal care helps identify pregnancy risk, and so the earlier those are identified, the better, and thus improves birth outcomes for the baby. We also know that babies who are born to mothers who don't receive prenatal care are 3 times more likely to have low birth weight and 5 times more likely to die than those born to mothers who do get prenatal care. So between these 3 objectives, as I said, we hope that we begin to see some work in the infant mortality rate in our community.
I have a question.
Yes.
What are the key points as far as sleeping for babies?
It used to be the Back to Sleep campaign, and now it's really the Safe to Sleep campaign. And so the main things are they still want them on their backs.
Okay.
And a safe sleep environment is basically just a baby on an improved firm mattress. We don't want anything in the cribs, no stuffed animals, no bedding, no pillows, and no bumpers. So those are really the key things. There's other things that you can do to reduce SIDS, but those are the key elements of what a safe sleep environment should look like.
Okay. Thank you.
We're now going to have Alyssa Staley from the Topeka and Shawnee County Public Library and Craig Barnes from the Shawnee County Health Agency talk about healthy eating, active living.
Craig Barnes, Shawnee County Health Agency.
Lisa Staley, Health Information Librarian at the Topeka Shawnee County Public Library.
And we're going to talk about healthy eating and active living. Pretty straightforward work group, looking at a lot of things that have to do with access to healthy foods and increasing the ability for not only our kids but our adults to have a safe and accessible environment to work out and have an active lifestyle. So what we're looking at here is 67% of Shawnee County's population are overweight or obese. With that, those numbers broke down. 36% are overweight and 31% are obese. Obesity is a BMI above 30, overweight, a BMI from 25 to 30. Both of those numbers are above the statewide averages for both overweight individuals as well as obese individuals. So what we know is that physical activity and nutrition are 2 of the 3 leading causes of chronic disease. And with that, looking at activities that are going to be related to healthy eating and active living is going to improve quality of life, help prevent chronic disease, as well as lower healthcare costs. What we also know is that through effective public health interventions and policies, those will lead to a healthier population with lower healthcare spending, less school and workplace absenteeism, and is also an increase in economic productivity.
So our goal is kind of a big one, to create an environment and culture through policy and system change that will provide Shawnee County residents with the information, tools, and resources to promote healthy eating and choose active lifestyles. So that's not just, here's an apple, let's go for a walk. It's a lot bigger than that. The World Health Organization, it would be awesome if it was that easy. We could implement that right now. The World Health Organization recognizes the increasing prevalence of childhood obesity results from changes in society. And now these, I'm deferring to the World Health Organization because these are big things. Childhood obesity is mainly associated with unhealthy eating and low levels of physical activity, but also increasingly linked to social and economic development and policies in the areas of, here's just small things to work on, agriculture, transport, urban planning, the environment, food processing, distribution, and marketing, as well as education. So those are some small things that we would like to work on in these policy and system changes that affect our health factors, as we saw in the presentation earlier as well. We're not doing this alone by any means. Some of the partners that we've engaged and have at our table for healthy eating and active living include the Kansas Health Institute, Kansas Action for Children, Blue Cross Blue Shield of Kansas, Harvesters, Topeka Common Ground, YMCA, YWCA, Boys and Girls Club, KDHE Bureau of Health Promotion, the American Heart Association, Wellness Information Networks, Family Service Guidance Counselor. We're trying to engage people who interact in these ways with our community and have them at the table and support their programs and have us working towards this pretty big goal for our county.
And so with that being said, our 4 main objective areas here are to decrease the percentage of adults who are considered overweight and obese, increase fruit and vegetable consumption so that families have access to that nutritious food, increase physical activity, that's looking at environments to increase not only access to a safe environment to exercise, but just kind of increasing the mantra of getting out and just being active, getting up out of your seat from your office, maybe every hour and just kind of moving, just kind of getting some actual activity in. And then increasing the number of households with access to healthy, nutritious foods So whether that be with community gardens, farmers markets, increasing the ability for farmers markets to maybe take SNAP benefits, so those moms and families actually have access to some healthy foods using their SNAP benefits and everything. So, and that's our Healthy Eating and Active Living group. So, thank you.
Now I'd like to introduce Jim Daniel, who is a community volunteer, retired from the St. Francis Hospital, and Lenora Kinsey from Stormont Vale Hospital.
Jim Daniel, good morning.
Morning.
I was asked to be one of the co-chairs based on my previous work as I was the Director of Strategic Planning at St. Francis for over 20 years, and I'm also have been either as an employee or as a board member. I'm knowledgeable about public transportation, having been on the Transit Authority. I go back to the mid-1970s. And you always want to learn something. I've learned this morning that I have 9 more years to live till I get up to be average in our community, and it's more than an apple and go for a walk. So far, that's my takeaway from the meeting. How did we get to this point? We got to this point in an unusual situation for a community health improvement plan. The one I was familiar with was in the mid-1990s. It was a community needs assessment, and it talks about the things you've heard about so far, the healthy babies, the healthy individuals. The focus groups, however, in our community this time identified 2 issues, at least the 2 that we're working on, which are access issues, which are normally not included in a community health improvement plan. One is the access to information, quality information about healthcare, and the other is access to transportation. And we'll talk about both of those in a moment, but they're typically not included. But again, our local people, particularly the health professionals, felt that it was important to address those issues, so we will. Lenora, in a moment, will talk about where we're going to go, a little bit about how we got here. As Allison pointed out, we've worked over the last several months with I think, a very decent-sized group of people who've been interested in both information and transportation as it relates to healthcare, and we hope that they stay with us in the coming months for the harder work of trying to define what actions we're going to take to address those issues. People do need access to information about healthcare, either for healthy habits, or you may have received a diagnosis, or one of your family members has received information that you want to find out more about. And we hope to be able to create a local focus where people can go top of mind to search for quality health information, rather than simply plugging in something to Google or Yahoo or Bing or Chrome or something. And sometimes the information you get when you do a search like that may not be the information that you want or you need. As far as transportation goes, people usually rely on family and friends or themselves to get to medical appointments, to get to therapy, to follow up a diagnostic. And I know I was fortunate, a little over a week ago, my son was able to accompany me to a medical diagnostic that I was given a sedation. I couldn't drive. People sometimes don't have family. They don't have either a private automobile. They rely on public transportation. They may not be able to get off work. There's a lot of reasons people don't follow up or aren't available. That's very frustrating for the health professionals here in Topeka, and that's why they raised that issue. Lenora is going to visit about our goal now with you, and again, we look forward to working with folks in our community to try to improve access to information and to transportation.
As Jim said, my name is Lenora Kinsey. I'm the Director of Library Services at Stormont Vale Healthcare. And I'm going to start because to me this has been a passion and it's just an overlay when you talked about the why, and I'm just going to step back just a minute. I won't step back, but the why, because of that information with health literacy, the Healthy People 2010 and 20 both said that health literacy is so important. It's the ability for people to obtain, to process, and then to make decisions on their health care. And we know that 12% of the people in the United States understand health care. 12%. The rest of the group, and I'm included too, if something happens, I'm like, where do I go? Who do I call? And I think I'm pretty savvy in the healthcare system. But it's from things like how to take a temperature, when is my appointment, should I take my medicine with water or not? How important it is that they give young people, young parents, a list of vaccinations. Do they understand how important it is for their children to be vaccinated at a certain time? Why it's important, the mammograms that were discussed. And then it gets to things more complicated about what kind of insurance do I need? And now we have the new Medicare and the ACOs and different things. It is just overwhelming, the healthcare. And so to me, that's why this is so critical and important for our community. So I'm very glad that the focus groups brought this up. So our goal is to promote awareness and connectivity to allow people to access that information, which is the beginning of the whole health literacy thing. Steps on that. And what we want to be able to do as a group, we're working on, we've had lots of discussion. We've had typically 12 to 15 people at our meetings, and I'll tell you the groups in a minute who that's represented. But we want to identify what's available in our community. Again, I think, as being a librarian, I kind of know what sources are out there and resources, but I don't think I have a clue what's all out there. And to then, are there areas that there are not even resources that exist, and that could be our group, a future goal activity to maybe put some of these things in place. But to identify and reduce both in healthcare and transportation. As Jim said, we've noticed in health literacy, they say 2 people don't understand about their appointments, and they miss sometimes because they can't read instructions, or appointments are usually 8 to 5, and I don't have anybody to get me there. And it's so simple, that impacts their health. And then we want to be able to provide a centralized location. We've kind of talked among our group of 211 is out there. CRC has a resource directory. The public library has kind of a resource connection. What's the best place? We really want to have one place identified that whether the individual, whether the physician, whether the librarian needs to get a resource, they all know to go to that one place. And then we'll need to increase awareness of that. Transportation, of course, we've talked about the Topeka Metro, but there are a lot of transportation services out there. Maybe there are social services in town that provide transportation. And I say maybe because I know we don't know what exists out there. I listened the other day to commercials, and as I was getting ready in the morning, it was like American Red Cross. I'm thinking, oh yeah, they should be a resource. Midland, oh yeah, they better be in that resource directory. So already, that idea of having people gather the resources and it can be put in one area and that we know. So I got excited. A couple of things I saw just last week that Boston, they've got a project going on now that they have their physicians, and it really ties into all these other projects, and it talks about the social environment or stuff. But as physicians are counseling their patients, they say to them, this group is providing a class on the DASH diet. It's scheduled at this time in April. Or this group is, you need to increase your activities. Here's a list of all the walking trails in Shawnee County or all the biking trails. And that resource is there to it's not all about illness, it's keeping your health there and working on that. And I was even thinking, wouldn't it even be nice as people, when we get our appointment, and that kind of ties into transportation, that in the future, you get that automated, your appointment is next Monday at 2:30, please come in, But it's something could be tied onto that message, and sorry, that voice wasn't very pleasant, was it, with my computer voice? But also could be something tied on there that we have this resource in Shawnee County that if you're unable to get transportation to get there, here is a resource, here's a connection to get you there. I mean, it again is us serving our citizens in Shawnee County. Some of the groups that have participated are St. Francis Hospital, Stormont Vale, Shawnee County Health Department. We've had Vallejo. It's not all physical health, mental health there as well. CRC, the Topeka Metro, the Shawnee County Health Agency, Salvation Army, LULAC, Jayhawk Area on Aging, Mirror, Head Start, the City Housing and Neighborhood Development, Shawnee County Parks and Rec, Washburn Tech, and USD 501, and Aldersgate are the group that come pretty consistently to our group. And we know we're going to need more workers and to get a big grip on, get our arms around all of this. So thank you very much.
Thank you.
Now we'll have Tara Dimmick from E2 Communications come out and talk about complete streets.
So I also serve as the interim co-chairs. We say that because we really want additional co-chairs. So I'm pleased to let you know that Emma Starkey will also be an additional co-chair, and Emma is with Heartland Visioning. And Allison is my co-chair as well. Sorry, Allison. Okay, so why Complete Streets? You guys have heard of Complete Streets. You know all about Complete Streets. You know how important it is. But the thing that we really saw just to restate it, this isn't part of the Community Health Improvement Plan. This is part of the Kansas Health Foundation grant that we've received over the last, it's a total of 4 years by the time it will finish. And it is all focused on complete streets, built environment, creating policies that are around complete streets in a healthy built environment. So for us, what happened though was we realized that complete streets hold hands with everything from healthy babies to the access, transportation, knowledge, to healthy eating and active living. They all hold hands together. So complete streets will improve safety, health, economic, and environmental outcomes. It emphasizes the importance of safe, convenient, and comfortable transportation and access for users of all ages. And I think the biggest thing about complete streets for our work group is we've got an incredible street system. We've got an incredible community. And it was built to be exactly what it is, and now we just need to step in and improve it based on what the needs of the community are now. So our goal is to have policies in place to ensure that Shawnee County will have complete streets for future generations to enjoy. So hopefully I get to see them, but I'm doing this for my kids, maybe my grandkids. Hopefully they stick around. Our work group, we actually have 3 objective areas, I believe that's on your sheet, but we are working to create a complete streets policy and design standards at the city level. I'll just mention we do have a complete streets resolution at the city level, and MPTO has a complete streets policy. The critical part of this is that it doesn't really have teeth, and so we need it to have teeth where when a street is changed, construction's made, it becomes a complete streets in that process. And then have a complete streets policy and design standards at the county level. The third point that's not on there that we discussed quite a bit was actually to create a good communication line between city, county, but also within departments within the city, departments within the county. If a street is going to get pulled up or some kind of construction is going to happen, for make sure that communication is strong between various departments, and then also between the city and the county. And that's it for complete streets. I'm the fast one of us, so I will when we do this next portion. Let me see it a little bit.
We're gonna play a very quick video for you all. If I can get the mouse to work with me. Down. We're getting closer, maybe. There we go. There we go.
I can talk about it. All right, we'll have her put it up when it gets up there. You got it. So the next steps, I hope you were able to kind of hear all their comments and maybe consider the fact that if our average is 75, that means our children, grandchildren are at 70. And even just think for yourself, 5 years, what would you do if you had 5 more years? I mean, how many of us think, I'll do that tomorrow? And, you know, a year goes by and you're still gonna do that tomorrow. What if you lost 5 of those years? So this is kind of our reminder of why we are all doing the work we're doing. And we just recently did this shirt, and it's for our Heartland Healthy Neighborhoods partners. And it says, coming together is a beginning, and that's what we've done. We've come together, we're kind of listening to the goals and objectives that we have. Keeping together is progress. I think that's probably the hardest part, right? It's so easy to say, okay, well, we did our part, so now we've got other things to do, other things on our to-do list, so now it's that fight to keep together. And then working together is success. So the next stages that we're working towards over the rest of this year is to develop strategies and tactics for each of these work groups and the individual organizations to work on. And we will continue to make progress. And we hope that with your help, that'll all lead to great success for our community.
I think at this point, we'll go ahead and open it up, see if there's any questions or comments from you all or anybody in the audience, and then we'll wrap up when we're done.
Commissioner?
5 years, and that's what we're talking about, is that 5 years. And I think just looking at it in the basic terms of not trying to tackle, consistently we heard today, we're not going to try and change everything in one step. We're going to do this a little bit at a time. We didn't get here overnight. We won't get back overnight. But 5 years is, an achievable goal. And so it gives us perspective as the Board of County Commissioners and the Board of Health as to what our job is when we set policies. So thank you.
Thank you. Commissioner?
I don't know if all of you saw the bulleted item. It was bold-faced, but it said, Heartland Healthy Neighborhood is working to have healthy families in Shawnee County. And really, that's what it's all about. And as we keep going forward, we're going to figure out how to do that, what that all means. So I think we're off to a really good start. I'm very appreciative that you have made this happen today, so that we can be part of that going forward, and what you need to bring to us, what we need to do. I think that's really important. I know there's a lot that we can do, but I'm also very encouraged to see John Knight here as Parks and Recreation.
Mm-hmm.
Tom Block is back in the back of the room with Public Works, and so realizing that a lot of our departments at the county really kind of overlap with what you all are doing. So I hope that the other commissioners join me in standing ready to do what we need to do.
And Rich Eckert's here too. Just didn't want. I have a question for Allison, and some people are maybe familiar with gap analysis. And essentially that's a systematic approach to say, how do we get from here to where we want to be? And given that, what are some of the obstacles that we face in getting us to where we want to be?
Well, I think that the community needs to come to consensus on how they want to get there. And it's going to take all of us. It's not any one organization that's going to be able to make a change. It's going to take all of us, and it's going to have to take investment of time, of resources, whether it's the community as a whole, just members that are living here, folks that are working here. It takes all of us to do that, and those are going to be the biggest challenges, I believe, are going to be the consensus and continued ongoing hard work. It's not easy work at all.
Okay. Thank you, Allison. Are there any other public comments to be made? Well, I guess oh.
Alice Weingartner, Shawnee County Health Agency Community Health Center. While I didn't intend to speak, I do want to acknowledge the work of this, because I have been with the Shawnee County Health Agency for almost 13 years now, and this is long overdue. So I am very excited I know our team is very excited, and I really appreciate the community support that has come through to help us move in this direction. So thank you.
Good. Thank you, Alice.
I'll add to that too, though, that while we have several staff members here, there's a good amount of volunteer work in this, that we're heavily invested in this. And so you all have day jobs as well, but you're taking time in the library, and my goodness, so thank you, all of you.
Yeah, thank you. That's a good point.
Just to wrap up, we talk about Board of Health meetings and kind of how we're gonna continue these on in the future. My hope is that we can have quarterly meetings, and then as needed, if something should come up, and I always go back to the H1N1 example. That was a very big activity in our community that required a lot of resources, and there was a lot of information moving and changing very, very rapidly. So the ability to have the Board of Health convene as needed will be very important for us in the future. We hope to have the next meeting in July. That date is not established yet. I think we've decided that we're going to continue to have those in this setting so that we can video record them, have the public here, the media here if they want to be present, and any other members of the community. So we will get those invitations out as the next one is scheduled. I do want to, again, thank and acknowledge all the work for the co-chairs. Without them, this work would not be moving forward. It's a major undertaking for our community. And you can see just from the folks that came up here that we have lots and lots of investment. We've got very excited and engaged people, so we're very fortunate to have them agreeing to work on the work that's happening now. And even outside of who you see here represented in this meeting, it's amazing. I would invite anyone to come to the Heartland Healthy Neighborhood Monthly Meetings. They are the second Monday of the month from 11:45 to 1. They're at the Avondale East Elementary School. And the energy's fantastic. There's lots of hard work going on. We have more and more members coming all the time, so I would extend that invitation to you all, along with the public. So anybody, we welcome additional people. Also, thank you all for agreeing to have this Board of Health meeting. I know this is another meeting, and you're already very taxed schedule, so I do appreciate the time. And where's our IT department? Are they here today? If they're not here, they're watching us from the background, and they have worked very hard to get it so that we could live stream this. So I want to just thank them for that. And with that,
Well, I, for one, will support public meetings on a quarterly basis. I think it keeps us informed, and I think it serves to inform the public. And that is key to being successful. So I will support that. I appreciate everyone attending, and Allison for your putting this on. Did you have something
Well, it
additional,
just,
Commissioner?
additional, for more information, if the public wants to find out more, Allison, where would they go?
we're actually going to be putting together a website for Heartland Healthy Neighborhood, so there will be some information forthcoming there. We also have on the health agency website, along with the hospitals, we have our community health assessment. The full report can be found there. They're more than welcome to call the health agency and ask to speak to me, and I'm happy to visit with them about what we're doing.
Anything else, Commissioner?
I don't think so.
Okay. Again, thank you all. We're adjourned.